Hi everyone, welcome back to the channel. If you're new here, welcome. Today, I'm talking about something affecting millions of people worldwide, a deficiency so common that doctors call it a silent epidemic. Right now, as you're watching this, your bones might be getting weaker. Your immune system could be struggling. Your heart might be working harder than it should. And you probably have no idea it's happening. Studies show that 1 in 3 adults has suboptimal levels of this critical nutrient. That's millions of people walking around with insufficient amounts in their bodies. The scary part is most don't experience obvious symptoms until serious damage has already occurred. We're talking about bone fractures from minor falls, frequent infections that won't go away, unexplained muscle weakness, persistent fatigue that sleep doesn't fix. This isn't some exotic condition requiring expensive treatments. This is something your body desperately needs, but most people aren't getting enough of through their normal daily routines. Your bones need it. Your muscles depend on it. Your immune system can't function properly without it. Even your heart requires adequate amounts to work efficiently. Medical research confirms that insufficient levels significantly increase your risk of osteoporosis, cardiovascular disease, autoimmune conditions, and frequent infections. Children with severe deficiency develop rickets, a bone-deforming disease. Adults develop osteomalacia, causing bone pain and muscle weakness. The elderly face dramatically higher risks of dangerous falls and fractures. Here's what makes this particularly concerning. The deficiency doesn't announce itself. You can go years with low levels and feel mostly fine until suddenly you're dealing with a broken hip from a simple stumble or recurring respiratory infections your body can't fight off. By then, significant damage has already happened. The nutrient I'm talking about is vitamin D. And today, we're covering everything you need to know. How it works in your body, the diseases it prevents, proper dosages, the serious risks of deficiency, problems from taking too much, and how to maintain optimal levels safely. This is medically verified information from clinical research and health organizations worldwide. Quick reminder before we start. This video is educational. Always consult your doctor about medical concerns. I'm providing information to help you have better conversations with your healthcare provider and make informed decisions. Your doctor knows your complete medical history, your medications, your specific situation. Use this information responsibly and work with your medical team. Let's talk about vitamin D and why it matters so much for your health. Vitamin D functions as a hormone, not just a simple vitamin. When your skin gets exposed to UVB sunlight, it converts a cholesterol compound into vitamin D3. Your liver then converts it to 25-hydroxyvitamin D, the form doctors measure in blood tests. Your kidneys transform that into the active form called calcitriol. This active form regulates over 200 genes in your body. Vitamin D receptors exist in nearly every cell type, including your bones, muscles, heart, immune cells, and brain. When calcitriol binds to these receptors, it influences how your genes produce proteins that control calcium absorption, immune responses, cell growth, inflammation, and cardiovascular function. Your body absorbs almost no calcium without adequate vitamin D. The vitamin acts like a key unlocking your intestine's ability to pull calcium from food into your bloodstream. Without this process, your body steals calcium from your bones to maintain blood levels, weakening your skeleton over time. Clinical studies demonstrate that maintaining adequate vitamin D levels combined with calcium significantly reduces fracture risk in older adults. Research shows individuals getting 700 to 800 IU daily experience fewer bone breaks and falls. Your bones continuously rebuild themselves, and they need both calcium and vitamin D for that process. Without enough vitamin D, bones become porous, weak, and brittle. Osteoporosis affects millions of older women and men, causing bones to break from minor impacts that healthy bones would easily withstand. Rickets affects children with severe vitamin D deficiency, causing soft, deformed, painful bones. The legs bow outward, the wrists and ankles swell, and growth becomes stunted. In adults, the same deficiency causes osteomalacia, leading to bone pain, muscle weakness, and difficulty walking. These conditions respond well to vitamin D supplementation with proper medical supervision. The bone pain from osteomalacia can be so severe that climbing stairs becomes impossible, and getting out of bed feels like torture. Research from the VITAL trial found that adults taking 2,000 IU of vitamin D daily for 5 years had a 22% reduced risk of developing autoimmune conditions, including rheumatoid arthritis, lupus, and psoriasis. Vitamin D modulates immune function, helping prevent your immune system from attacking your own tissues. This happens because vitamin D helps regulate T cells and other immune components that can become overactive and target your own body. Studies show vitamin D supplementation reduces the incidence of acute respiratory infections, especially in people with deficiency. The vitamin supports infection-fighting cells and helps regulate immune responses to viruses and bacteria. People with adequate vitamin D levels recover faster from colds and flu and experience less severe symptoms. The antimicrobial effects of vitamin D help your body produce natural antibiotics called antimicrobial peptides that directly fight infections. Vitamin D influences blood pressure by acting on blood vessel cells and heart muscle. It helps regulate the renin-angiotensin-aldosterone system that controls blood pressure. Deficiency has been linked to hypertension, arterial stiffening, left ventricular hypertrophy, and heart disease. Research shows vitamin D helps blood vessels stay flexible and responsive, reducing strain on your heart. While large trials haven't confirmed that supplementation prevents cardiovascular events in the general population, maintaining adequate levels appears important for overall cardiovascular health. Emerging research suggests vitamin D may slow biological aging by protecting telomeres, the protective caps on the ends of chromosomes. Studies found that people taking 2,000 IU daily experienced significantly less telomere shortening over 4 years compared to those taking placebo. The effect was equivalent to preventing nearly 3 years of aging. Telomeres naturally shorten as we age and with each cell division, and shorter telomeres are linked to increased risk of cardiovascular disease, Alzheimer's disease, and multiple sclerosis. Vitamin D plays a crucial role in muscle function beyond just preventing weakness. Research demonstrates that adequate vitamin D improves muscle strength, balance, and physical performance, especially in older adults. This matters because better muscle function directly translates to fewer falls. Falls are the leading cause of injury and death in people over 65. And the combination of weak bones plus weak muscles creates a dangerous situation. Studies show that vitamin D supplementation of at least 700 to 800 IU daily reduces fall rates by preventing the muscle weakness that leads to instability and loss of balance. The connection between vitamin D and cancer has been extensively studied. The VITAL trial found that high-dose vitamin D supplements taken over 5 years reduced the risk of advanced cancer by approximately 20% in people without cancer at the start of the study. Advanced cancer means cancer that has spread beyond its original location or proved fatal. Vitamin D seems particularly protective against cancers linked to inflammation or problems with immune system regulation. The mechanisms likely involve vitamin D's role in controlling cell growth, preventing abnormal cell division, and supporting immune surveillance that identifies and destroys cancer cells before they become dangerous. Research links vitamin D to cognitive function and brain health. Vitamin D receptors are abundant in areas of the brain involved in memory and cognition. Studies have found associations between low vitamin D levels and increased risk of cognitive decline, dementia, and Alzheimer's disease in older adults. While supplementation trials haven't yet proven that vitamin D prevents cognitive decline, maintaining adequate levels throughout life may support long-term brain health. The vitamin appears to protect brain cells from oxidative stress and inflammation that contribute to neurodegenerative diseases. Vitamin D influences insulin sensitivity and glucose metabolism. Research shows that adequate vitamin D levels help your body use insulin more effectively, which is critical for preventing and managing diabetes. Studies found that vitamin D supplementation, especially in people with deficiency at baseline, can reduce insulin resistance to a small but meaningful degree. This matters because insulin resistance is the core problem in type 2 diabetes. While vitamin D isn't a cure for diabetes, maintaining optimal levels may help support better blood sugar control when combined with diet, exercise, and medication as prescribed by your doctor. Depression and mood disorders have been linked to vitamin D deficiency in numerous studies. Vitamin D receptors in the brain influence the production of neurotransmitters like serotonin that regulate mood. People with very low vitamin D levels report higher rates of depression and seasonal affective disorder. While clinical trials haven't conclusively proven that vitamin D supplements treat clinical depression, some research suggests supplementation may help improve mood, especially in people with documented deficiency. The connection makes biological sense given vitamin D's role in brain function and the fact that seasonal depression worsens during winter months when natural vitamin D production drops due to reduced sunlight. Vitamin D supports healthy pregnancy outcomes. Studies indicate that adequate vitamin D during pregnancy is essential for proper fetal bone development, brain development, and lung maturation. Deficiency during pregnancy has been associated with increased risk of gestational diabetes, preeclampsia, preterm birth, and low birth weight babies. The Endocrine Society recommends empiric vitamin D supplementation during pregnancy due to the increased risk of deficiency and the impact on neonatal outcomes. Pregnant women should discuss appropriate supplementation with their obstetrician to ensure both mother and baby have adequate levels. Psoriasis, the chronic skin condition causing red scaly patches, responds to vitamin D treatment. Topical vitamin D in forms like calcipotriene or calcitriol applied directly to affected skin helps slow the rapid skin cell growth that characterizes psoriasis. This treatment works better when combined with corticosteroids than either treatment alone. The vitamin's effect on cell growth and immune regulation explains why it helps control this autoimmune skin condition. The recommended amounts vary by age and individual circumstances. These are general guidelines from major health organizations. Infants up to 12 months need 400 IU daily. Children and teens from 1 to 18 years need 600 IU daily. Adults 19 to 70 years need 600 IU daily. Adults over 70 years need 800 IU daily. Pregnant and breastfeeding women need 600 IU daily. Many experts suggest these minimum recommendations may be insufficient for optimal health. Achieving blood levels above 30 nanograms per milliliter often requires 1,000 to 2,000 IU daily from diet and supplements combined. Some researchers argue that levels between 40 and 50 nanograms per milliliter provide the most health benefits while remaining completely safe. For treating deficiency, Doctors typically prescribe 50,000 IU weekly for 8 weeks, then maintenance doses of 800 to 1,000 IU daily. Always follow your doctor's specific recommendations for your situation. The high-dose treatment quickly replenishes depleted stores, then maintenance dosing keeps levels stable long-term. People with obesity, malabsorption conditions, or those weighing over 200 pounds often need 2 to 3 times the standard dose to achieve optimal blood levels. This happens because vitamin D gets stored in fat tissue, making it less available for your body to use. If you're overweight, don't assume standard doses will work for you. Get tested and work with your doctor to find the right dose. Very few foods naturally contain significant vitamin D. Your main dietary sources include fatty fish like salmon, mackerel, sardines, and tuna, which contain 400 to 600 IU per serving. Wild-caught salmon has more vitamin D than farm-raised. Cod liver oil provides about 1,360 IU per tablespoon, but tastes terrible, so most people prefer supplements. Beef liver has small amounts, approximately 50 IU per serving. Egg yolks contain roughly 40 IU per egg. Some mushroom varieties, especially those exposed to UV light during growing, provide 400 to 450 IU per serving. Fortified foods include milk, orange juice, breakfast cereals, and some plant-based milk alternatives. Check nutrition labels to verify vitamin D content. A cup of fortified milk typically contains 100 to 120 IU. Most people cannot get sufficient vitamin D from diet alone, which is why supplementation is often necessary, especially during fall and winter months when sunlight exposure decreases. Even if you eat fatty fish multiple times per week, you're probably only getting 1,000 to 1,500 IU weekly from food, which isn't enough for most adults. Vitamin D deficiency often develops silently. Watch for these warning signs: bone pain, muscle weakness, muscle aches, difficulty climbing stairs or standing from sitting. You might notice your legs feel heavy, or that getting up from a chair requires using your arms for support. Frequent infections like catching colds and flu repeatedly, respiratory infections that linger for weeks. If you're sick more than twice per winter, low vitamin D could be contributing. Persistent tiredness unrelieved by sleep. This isn't normal fatigue from a busy day. This is exhaustion that makes it hard to function even after sleeping 8 hours. Low mood and decreased cognitive function. Brain fog, difficulty concentrating, memory problems. Cuts and injuries taking longer than normal to heal. A paper cut that's still visible after 2 weeks or a scraped knee that takes a month to fully heal suggests impaired immune function. Thinning hair, especially in women. Hair loss from vitamin D deficiency affects the entire scalp, not just a receding hairline. Bone fractures from minor trauma or falls. If you break a bone from stepping off a curb or bumping into furniture, your bones are dangerously weak. Severe, prolonged deficiency leads to hypocalcemia, causing muscle cramps, numbness, tingling in your hands and feet, heart rhythm abnormalities that feel like palpitations or skipped beats, and in extreme cases, seizures. These severe symptoms require immediate medical attention. People with dark skin face higher risk because melanin reduces vitamin D production from sunlight. Those with African, Caribbean, or South Asian backgrounds need 3 to 5 times more sun exposure than light-skinned individuals to produce the same amount of vitamin D. This makes supplementation especially important for people with dark skin living in northern climates. Elderly individuals experience declining skin ability to produce vitamin D, dropping by about 75% between age 20 and age 70, and typically spend less time outdoors. People who stay indoors, those who are housebound, frail, or work night shifts, get minimal sun exposure. If you work in an office all day and commute in darkness during winter, you're producing almost no vitamin D naturally for months at a time. Individuals with obesity have vitamin D sequestered in fat tissue, requiring higher doses to achieve adequate blood levels. People with malabsorption conditions like Crohn's disease, celiac disease, cystic fibrosis, and kidney disease experience interference with vitamin D absorption and activation. Breastfed infants need supplementation because breast milk contains minimal vitamin D, only about 25 IU per liter. Supplements come as D2, ergocalciferol from plants, or D3, cholecalciferol from animals. D3 is more effective at raising and maintaining blood levels. Most experts recommend D3 supplements. Vitamin D is fat-soluble, so take it with a meal containing some fat for better absorption. A meal with avocado, nuts, eggs, or olive oil works perfectly. Time of day doesn't matter significantly, so take it whenever you'll remember consistently. Blood tests measuring 25-hydroxyvitamin D determine your status. Levels below 20 nanograms per milliliter indicate deficiency. Levels between 20 and 30 suggest insufficiency. Optimal levels are generally considered 30 to 50 nanograms per milliliter, though some experts argue for 40 to 60. Talk to your doctor before starting supplements, especially if you take medications or have health conditions. Your doctor can order blood tests and recommend appropriate dosing for your situation. You cannot get too much vitamin D from sunlight. Your skin regulates production naturally and stops making it once you have enough. However, excessive supplementation can cause toxicity. Symptoms include hypercalcemia, dangerously high blood calcium causing nausea, vomiting, weakness, frequent urination that disrupts sleep, excessive thirst where you're drinking gallons of water daily, and kidney stones that cause excruciating pain. Bone pain can occur despite vitamin D's role in bone health. Too much vitamin D actually accelerates bone breakdown. Excess calcium can damage kidneys, leading to kidney stones and chronic kidney disease that may require dialysis. Digestive issues include severe constipation, poor appetite where food becomes unappealing, and stomach pain. Neurological symptoms include confusion where you can't think clearly, disorientation about where you are or what day it is, difficulty walking with an unsteady gait, and slurred speech. Adults should not exceed 4,000 IU or 100 micrograms daily without medical supervision. Children 1 to 10 years have a maximum of 2,000 IU daily. Infants under 12 months have a maximum of 1,000 IU daily. Toxicity is rare but serious. Cases typically involve manufacturing errors in supplements, people accidentally taking weekly doses daily, or prolonged excessive supplementation. Always follow recommended dosages and never assume more is better. Vitamin D can interact with several medications. Discuss supplementation with your doctor if you take statins, as high-dose vitamin D may reduce effectiveness of cholesterol medications, like atorvastatin, lovastatin, and simvastatin. Weight loss drugs like orlistat block fat absorption, which means you absorb less vitamin D from food and supplements. You may need higher doses if you take orlistat. Corticosteroids like prednisone and similar steroids lower vitamin D blood levels by interfering with absorption and increasing breakdown. If you take steroids regularly, you almost certainly need vitamin D supplementation. Thiazide diuretics, blood pressure medications like hydrochlorothiazide combined with vitamin D supplements could raise blood calcium too high, increasing kidney stone risk. People with certain conditions need medical supervision when taking vitamin D. Kidney disease impairs kidney function, affecting vitamin D activation and calcium regulation. Your kidneys convert inactive vitamin D to active form, so kidney disease disrupts this process. Sarcoidosis and other granulomatous diseases can cause dangerously high calcium levels with vitamin D supplementation because these diseases increase vitamin D activation. Hyperparathyroidism, overactive parathyroid glands, already elevates calcium-making supplementation risky. Adding vitamin D could push calcium to dangerous levels. History of calcium kidney stones requires caution with vitamin D and calcium supplementation because you're already prone to forming stones. Always inform your doctor about all supplements you take, including vitamin D, before starting new medications or treatments. Vitamin D is essential for bone health, immune function, muscle strength, cardiovascular health, brain function, and healthy aging. Deficiency affects millions worldwide, increasing risks of osteoporosis, fractures, infections, autoimmune diseases, muscle weakness, falls, and potentially cancer and cognitive decline. Most people need 600 to 800 IU daily as a minimum, though individual requirements vary widely based on weight, skin color, sun exposure, age, and health conditions. Testing determines your specific needs. You get vitamin D from sunlight exposure, fatty fish, fortified foods, and supplements. Many people require supplementation year-round, especially during winter months or if they have risk factors for deficiency. Proper supplementation is safe when following recommended guidelines, but excessive intake causes serious toxicity, including kidney damage and dangerously high calcium levels. If you suspect deficiency, talk to your doctor. Blood tests measure your levels accurately. Your doctor can recommend appropriate supplementation based on your results, medical history, medications, and individual risk factors. Don't guess about dosing. Get tested, get personalized recommendations, and monitor your levels periodically to ensure you're in the optimal range. Share this video with family and friends, especially elderly parents, people who stay indoors frequently, or anyone experiencing unexplained bone pain, muscle weakness, frequent infections, persistent fatigue, or mood problems. This information could help someone maintain stronger bones, better immune function, and overall better health. Comment below. Do you take vitamin D supplements? Have you been tested for deficiency? What were your levels? Your comments help others learn and understand they're not alone if they're dealing with deficiency. Subscribe and turn on notifications for more evidence-based health information. No hype, no miracle cures, just medically verified facts you can use to make informed decisions about your health. Thank you for watching. Take charge of your health by understanding what your body needs. Work with your doctor to maintain optimal vitamin D levels. Get tested, supplement appropriately, and monitor your results. Stay healthy and informed. God bless.